Hello everyone. Today our topic of discussion is actinomycosis, that is a bacterial infection. Before starting, I would like to ask you to like, share and subscribe my channel. So, first of all, with the definition of actinomycosis, it is a rare subacute to chronic infection caused by the gram-positive filamentous non-acid-fast anaerobic to microaerophilic bacteria, that is actinomyces. The infection is usually granulomatous and suppurative infection where we can see the infiltrate of bacteria and dead tissue in the center and newly morphonuclear leukocyte and lymphocyte along with macrophages and multinucleated giant cells. Here in this picture we can see actinomycotic osteomyelitis where the infection has spreaded to the maxillary bone that can reach to the brain and meningeal. In this further picture, there is seen an abscess which is draining outside the oral cavity, extraoral abscess drainage. In the epidemiology, for actinomycotic infection can be found in any age group, but the peak incidence is found in the middle age. The infection is generally seen in the males, whereas it can also be seen in the females. The most commonly affected site is mandible. Also, salivary glands, tongue, and maxilla can be affected. The trauma also plays a role in initiating the entry of the bacteria, which will be further discussed in the video. The clinical forms based on location includes cervicofacial form, that is the most common form found in 2/3 of all the cases. The abdominal form seen in the ileocecal or uterine lesion. Pulmonary form seen as lung lesion. In this picture, we can see the cervicofacial or facial form where the maxilla and mandibular area or jaws are affected. In this picture, the mandible is affected, which can be seen as lumpy jaw syndrome. It can also be found in the cervical lesion. Etiology. As told earlier, trauma or accidental entry is the most common cause of endogenous infection of actinomyces, as the bacteria is already present as a commensal or normal flora in the oral cavity in carious tooth, non-vital root canals, gingival sulcus, and periodontal pockets. The cervicofacial form can be caused due to a trauma, dental extraction, or any kind of accident or blood exposure. The pulmonary or thoracic form is acquired due to the aspiration of the bacteria. Abdominal or pelvic form can be acquired through surgery or use of IOD when aseptic conditions are not followed. In the pathogenesis, when the bacteria enters through the blood, initially it causes acute inflammatory reaction that when untreated or not given proper treatment, it can lead to chronic indolent phase, there where the lesion can be present as single or multiple in duration. The central fluctuance along with pus filled with neutrophils and sulfur granules is the characteristic feature of the infection. Other associated illness are HIV, transplant, herpes, chemotherapy, cytomegaloviral, ulcerative mucosal lesion that are the most commonly seen immunosuppressant or immunodepressed conditions as HIV or transplant, where we give the immunodepressant drugs to prevent transplant rejection. There is less immunity present and that can lead to aggressive form of actinomycotic infection. Other less common conditions include osteoradionecrosis or systemic illness that can be seen along with actinomycotic infection. The clinical features include in the cervical facial form. It produces lumpy jaw syndrome when the actinomyces gains entry into the blood through oral mucous membrane while following a trauma or extraction. It can remain localized in sub-adjacent soft tissue, or it can spread to other tissues like salivary glands, tongue, rarely gingiva, bone, and skin of head and neck. That leads to swelling and induration of the tissue. Further, it develops one or more skin abscess that discharges upon the skin surface, as seen in this picture. The abscess that discharges upon the skin surface liberates pus containing sulfur granules that can be cultured over the petri dish like this. In chronic disease or healing or draining abscess through sinus, there can be a formation of new abscess that takes place, which causes perforation of skin surface and invagination into the bone, causing osteomyelitic infection, as seen in this picture, where maxillary osteomyelitic actinomycosis infection is seen. The perforation that leads to scarring and disfigurement of skin. The overlying skin appears purplish red, indurated, and has feel of wood. These all features together can be called as fluctuant features of the actinomycotic infection. In various stages, actinomycotic infection leads to invagination into the bone of mandible and sometimes maxilla. The extending infection of the tissue, soft tissue, into the bone that leads to involvement of cranium, meninges, and brain. If the involvement of maxilla is there is extensive tissue destruction that takes place, and infection can be localized to the apex of one or more teeth that mimics periapical or pulp related infection, as seen in this radiograph, where the lesion is confined near the root apex and it mimics other pulp related infection like pulp granuloma, periapical granuloma, or periapical cyst, or radicular cyst, or dentigerous cyst, as seen in these pictures, where there is a missing teeth also. The infection that may disseminate to distant organ like lungs, GIT, and brain can lead to abdominal or pulmonary form. Symptoms generally seen as in all kind of bacterial or viral infection are fever and chills. In the abdominal form, we can see GIT manifestation, nausea, vomiting, etc. In pulmonary form, there can be seen as a productive cough or pleural pain. In this picture, we can see that the lung tissue is invaginated and cleared through the area, and in the X-ray, it is seen as radiolucent area. In the histopathology, we can see the lesion of soft tissue or bone as essentially granulomatous with centralized abscess that shows characteristic microscopic colonies in the center. The colonies that appears floating in polymorphonuclear leukocyte C associated with macrophages and multinucleated giant cells around the periphery. That is granulomatous tissue formation. Individual colony that appears round, lobulated, made of meshwork of hematoxylene stained filament and eosinophilic club-shaped end. This appearance is often termed as ray fungus, and the infection is often misinterpreted as a fungal infection. Surrounding tissue around the lesion show fibrosis. The organism is generally better demonstrated by methanamine silver stain. For the differential diagnosis, considerable features are sulfur granules that can be also seen in chronic cervicofacial fungal infection, that is Bacteriomycosis, osteomyelitic form that can be caused by other bacteria like streptococcus, staphylococcus, or any kind of fungus. Soft tissue infection that can be seen along with staphylococcal infection. If it localized near the root apex, it can resemble the other pulp related infection or periapical lesion, that is periapical granuloma or cyst. Diagnosis. First of all, for diagnosis, we go for clinical findings, that is the basic clinical presentation of the infection that can resemble other diseases of suppurative bacteria or fungus that makes it not the best diagnostic criteria for the diagnosis. Tissue section or smear. Demonstration of organism can be seen in tissue smear, or biopsy of bone can be helpful in diagnosing the actinomycotic osteomyelitis. We can also perform the microbiology culture for the actinomyces bacteria, but as the most of the form of actinomycosis are polymicrobial, the streptococcus and staphylococcus strains can be also found along with the actinomyces as superinfections. PCR is a helpful technique in detection of organism from clinical samples, but since it is expensive and needs experience setup, it is often not used. The prognosis of the infection is often not good because of its aggressive nature and invagination into the bone and soft tissues. For treatment, we go for antibiotic treatment with high dose of antibiotics given for a long time. The antibiotics commonly given are penicillin, tetracycline, erythromycin. Along with the antibiotic treatment, surgical drainage of abscess and excision of sinus tract are necessary for accelerating the healing process and for the long-standing fibrosis, as antibiotics alone can't be used as the treatment. Thanks for watching my video. Like, share and subscribe my channel.